Welcome to the panel discussion organized at the Leave No One Behind Film Days. We aim to contribute to the activities evolving around April 7, World Health Day. We hope our film days may help to build a fair and healthy world. Leave No One Behind is an initiative of World Health Organization Turkey in collaboration with Ministry of Health, and it is funded by the European Union. We would also like to get your attention to 2021 International Year of Health and Care Workers. It has been designated in appreciation and gratitude for their unwavering dedication in the fight against the COVID-19 pandemic. Our selection primarily focuses on the life-changing health services for immigrants and refugees. The documentaries on our program underline the positive role played by the health and care workers. And today's theme is a fairer and healthier world. And we are going to screen the film Central Airport by Kerim Aynoz. And now we are here discussing the film with a very select crew. Mr. Ibrahim and Hussein is the main character in the film. Welcome. Dr. Monica Zikusooka is a monitoring and evaluation officer at WHO Turkey country office. She works with the refugee health program in implementing programs that aim at improving access to health services for refugees and migrants. And we have Dr. Muhammet Ceren here with us. He is a Syrian doctor working in the Migrant Health Center in Ankara, providing health services to Syrian population. The health center is operated by the Ministry of Health. So welcome everybody. I would like to start by asking Mr. Ibrahim and Hussein about the incredible experience he went through. We watched it in the film. Could you please tell us how you met Mr. Kerim Aynoz, who's a well-known film director who has competed in Cannes Film Festival, and then he surprised us with such a good humanitarian documentary. So let's begin from the initiation of this project, please.
First of all, thank you so much for having me here and inviting me. It's such a pleasure, of course, to be here and share the experience, my experience with you as well in such a nice country as Turkey. First of all, I met Kerim, of course, like in the airport in Tempelhof, where I was staying there for many reasons. The first reason, because he lives very close by to the airport and to the main part of Tempelhof. I think I met him like inside the airport. He was coming there to check, like there were like a lot of people coming to Berlin in that time in January 2016 when I arrived there. There was also a lot of media, a lot of interviews, so many people coming there, to check, to record, to document everything. And Kerim was one of the people who was like more interesting about the people, more like about the news. Like he was coming there to meet people, to know like more about their stories. And also, like, he has this idea to make a documentary about all the airports in Berlin, I think 4 airports or something like that. And he already started, before the refugees start coming to Tempelhof, he already started shooting in Tempelhofer Feld. I think somewhere around 2015. Mm-hmm. So I met him there. We start like, he start coming there like once a week or something like that. It was also like so hard to him to get permission to come inside, because it was like kind of impossible actually. But somehow he made it, and he started like coming there without camera, without any crew, just him coming there, talking to people. I think it was for us like very clear. We get like friends very fast. We even start like going outside to walk in the field. And I was like, me as the same as everybody who was like, you know, not willing to stay in Tempelhof and, you know, trying to do some act about it. To have such a kind of, you know, kind of better place to stay. I mean, in Tempelhof, it was like, you know, it was a place, a huge place for a military. It used for a military. We are like, you know, running out because of that. So it has like this background that everybody was, you know, not comfortable staying there. And also the whole situation in Tempelhof was like, you know, messed up. Like a lot of people, there was not so much care taken about people because of the huge numbers. I believe like in 2016 was like around 4,000 people living inside.
It's incredible, really. You know, you dream of a better life and you run away from a big chaos,
Yeah,
and then you fall into another chaos, I think.
exactly.
You
Yeah,
know, I mean, the images in the film really describe how surreal
yeah,
living in an airport is.
yeah, yeah.
So, how did you feel when you ended up there?
I mean, for me in the very beginning, I had like a lot of troubles, you know, communicating to the other people because of, you know, like I just arrived. I was like so tired. Running away from your own country, it was like a big decision in my life. You know, just looking for a new future and trying to do something about maybe the situation or the war in my country. So, you know, it was kind of a shock for me actually to be to start living there. And in the second hand, you know, it was all about my papers, my permission to stay in Germany, if I could stay or not. So it was all about waiting actually, you know, in Tempelhof, waiting for everything. You know, I was like, I was there just being able to go outside, maybe to learn some German, some, you know, going to German courses, and then coming back home to Tempelhof, which was, you know, for me, I was like trying to put myself out in the city, you know, walk more or discover the city instead of going and staying in Tempelhof, because it was like such a headache for everybody. Because as I said, the main reason it was like a lot of people, like in the hangar 7 where I was staying, there were, I believe, somehow 600 or 700 persons living there. Most of them like families with children. So it was like very nosy. Actually, I think that also you can hear it in the film as well.
Yeah, I know.
So
Well,
yeah.
thank you very much for the moment. We will, of course, come back to you, but I would like
Sure.
to ask Dr. Zikusooka. It's not the ideal, you know, condition to keep 4,000, you know, people in a huge, unused airport, I think, and it also not, you know, good for their health. I think the conditions are, you know, far from being ideal concerning hygiene. I mean, let alone privacy and those people who, some of them might be traumatic, of course, you know. What could you tell us about the film? When you watched it, what did you think about this situation in the airport?
Thank you very much, Elsin, and it's very nice to see you, Ibrahim, connecting
Thank
to
you.
the movie. And
Thanks.
very nice to also interact with Mr. Muhammet with the great work that you're doing at the Refugee Health Center. I think the movie was pretty interesting to see a huge number of people living in an airport. When we travel, we go through airports, but we know it's a transit time. You are there for a couple of hours and you're out. But to imagine that people were living there for months and a couple of years, I guess. I can't imagine what it was like for you, Hussein, but I just try to picture according to what you displayed in the movie.
Yeah.
And I think the thought of having 4,000 people in a small space can also be straining on many levels, you know, basically for being, having your own space or interacting with so many people, it could descend on mental health, how that's why I guess you had to move out a couple of days just to freshen yourself. But again, that is what many times is available when refugees arrive in a country. And I think governments really try their best to provide services. Many times it's not optimal, it's not the best, but they are trying. And in this case, we see in the movie that there were some efforts to provide some health services because they're very important. Health is something you can't postpone until tomorrow. You can't wait to be well, like you're waiting for your papers to be processed. If you're unwell, you need to be attended to, or you need to take steps to prevent yourself from getting sick. You need to do it now and not tomorrow. So we see that, I think, in the movie, where they are providing some services for example, immunization. We see some people being processed through, and those are really very immediate services that people need every day, so that, for example, children do not miss out on their immunization routine. And I guess you had some medical checkups just to check your health. And if you're unwell, I'm sure there was some form of facility. So this is something that we promote and really, I think, work with countries to be able to provide that basic services for people that are migrating origin into a country, because nobody should be left behind. Everyone has a right to be healthy wherever they are. So I think those are some of the things that I pick out of that movie. My first thoughts about what was being provided and what was available. But on another level is that the government or the facility owner, managers can provide those services, but the people also need to be aware of what is available and what care is available and what steps they can do to make to be healthy. And that's when we think about how health literate people are as they move into a space. Because when we talk about health literacy, we are thinking about someone's ability and motivation and knowledge to access health information, to use it, to be able to make everyday decisions concerning their health. So a mother has got to know that immunization, not missing immunization, is very important. Or people need to know healthy lifestyles that could prevent diseases. So on a personal level also, we hope that the refugees and migrants can be helped to get information that helps them to make good decisions about their own health, even while they are in transit.
Yeah, thank you very much. So Dr. Ceren, when you compare these extraordinary conditions at the central airport with to those of the camps and migration centers in Turkey, what could you tell us about the health and care services?
Thank you very much for giving me this opportunity. First of all, I would like to make a correction. Dr. Muhammet, Ceren, Republic of Turkey, Ministry of Health, the DG of Public Health, Migrant Health Services. I'm not working in a migrant health center. I'm working in the Ministry of Health, Department of Migration. Let me make this correction. Actually, can you hear me?
Yes.
Of course we can.
Actually, migration has similar points in the world. As we can see in the film, first the decision of migration is taken, then the journey starts, and then a couple of countries are passed through, then they are staying in the camps. There could be some problems, language problems, culture problems, climate problems, and the Republic of Turkey considers health services as a fundamental human right. So all those services are provided accordingly. Accessibility, equality, fairness, all those principles are considered for providing the health services. So the migration became a mass migration in the country. And Ibrahim was one of those migrants coming to the country. And also while providing all those services, it starts at the border. For example, all emergency services are provided, and then vaccination is performed. And as Ibrahim experienced, they were moved to the camps. Actually, it was not a camp. Ibrahim was taken to the airport. In our country, we had 14, actually nearly 17 recently. We had all those camps. We had similar problems. And we provide all those healthcare services in 4 different fields. First one is the basic healthcare services. It's a must, as it is stated previously. Vaccination, for example. Secondly, health services are given in the hospitals. And we have emergency health care services. So some of the patients are taken from the border and then healthcare services are provided. And as of today, totally we had 185 million physical examination, 2.5 million Syrians were hospitalized, 250,000 surgeries were performed, and 650,000 deliveries were made. Of course, there were all language problems, and we have employed the interpreters having two different languages. Of course, we had similar cultures, and there were too many similarities. That's why we had not too many problems. However, of course, all those migrants can have the traumas. For example, they experience them in their own countries, then they have all those traumas during the transition period and in the destination country. After all those three traumas, as we can see in Ibrahim, it causes us stress. And Ibrahim felt in the dilemma. I mean, shall I stay or shall I go back? Missing the mother, taking the right decision, missing the village where he lived. So it's something very normal. It's a very difficult transition process for all the migrants. And we try to provide all those healthcare services in a better, in a more productive manner without any language barriers. For this reason, we employ the Syrian healthcare professionals, and we have established 180 migrant health centers in 800 units. And we try to increase the health literacy, and we distributed all kinds of leaflets, brochures to the patients and to the physicians. We provided in-service training, and we try to employ all those Syrian healthcare professionals. And it facilitates the accessibility for all those services for the migrants, and they receive the services as they deserve, as their rights. Of course, all those services are at an equal level. Actually, these services can be one step further for the migrants because all those services are sensitive to migrants. Therefore, there are no differences between the Syrian migrants and Turkish citizens for receiving these healthcare services. That's all for my side, but finally I can express something related to COVID. And once again, I would like to thank you because you have reminded that 2021 was dedicated for the healthcare professionals. Now, the migrants can receive the same services, same healthcare services, even they can be vaccinated. Migrants are grouped according to the age grouping, and there is no difference among the migrants and the Turkish citizens. According to each age group, all those individuals can be identified and they can be vaccinated. Within the scope of this issue, two different circulars were published by the presidency. The first one was related to the statement that COVID is an emergency and all the services will be free of charge. And secondly, vaccination and treatment will be free of charge in the hospitals. This was confirmed. And all those services are provided to the migrants as we have requested in an equal manner as a fundamental right. So I can say these things in the first run.
Thank you very much. It was very enlightening to find out all the details of the health and care services. So, Ibrahim, you were ill recently. We are very happy to see you have already recovered, and if there's we wish you good health. So you went through this process personally, you know, not only the difficulties of migrating, but then, you know, trying to get the status of the, you know, refugee, trying to remain in Germany. You had a lot of difficulties, and on top of everything, you were ill. And how were you treated, and how were these services? You don't have any language barrier, fortunately, but what was it like for other people? For example, your friends who were ill and couldn't speak the language. Can you give us a little bit of insight about these services?
Yeah, sure. I mean, yeah, first of all, I just want to say like the health situation, the whole health situation, maybe in Tempelhof where I was staying, it was like it was one of the best health situations in all the camps, maybe in Berlin. I mean, there was a lot of people, but also in the same time, there was like the best team of health. There was like a special clinic just for us that was also inside the hangar. So in this point, with the health, they were like really the best. And second, of course, like there's who couldn't speak English or German. I mean, everybody who came like in 2015 or 2016 couldn't speak German. So the second language is English. So I mean, the one who could speak English, it would be of course easier. But also at the same time, there was like a lot of translator, I mean, in the hospitals for everybody who couldn't speak the language. For example, I remember in 2016, like a friend of mine gets sick and he needed to do a surgery. So there's of course like a lot of doctors in the same time who could speak Arabic, maybe from Lebanon or Syria, already living in Germany. There's also a lot of refugees who were already staying in Turkey and speak the Turkish language, and you know as well, like there's also a huge Turkish community in Germany as well. So I think it was of course like difficult for some people, but in the same time it went like less forever, because like, you know, it's very easy to find somebody who could help you in the translations. So
yeah, thank you. Yeah, it's good to hear this, you know. It's very reassuring to know that you know, all these people in need are taken care of. But I think the World Health Organization also is very much involved in the worldwide refugee situation, Dr. Zikusooka. And because you are a monitoring and evaluation officer, I think, and I don't know how long have you been working in Turkey, but you must have experience, you know, in the international arena. Well, where do you think is the biggest achievement, and what can be done more to help people in need?
Thank you very much. I think I've actually learned a great deal from Turkey. This is the first country where I've worked that really hosts a large number of refugees. Anyway, it hosts the largest number of refugees in the world. So in our program, I've learned a great deal about the services that are available for refugees in this country. And I think they are pretty much, compared to many other places, they have a lot more that has been offered. They have provided, like Mr. Muhammet was saying, you know, language sensitive services. There's refugee health centers across the country. So many of them, we work with a lot of them. I've visited a number of them. And in all of these services, and one of the biggest thing I think that really for me is a big achievement is to have Syrian health workers. Because in these refugee health centers, they've hired Syrian doctors and nurses that can speak the language that the refugees speak. So making it easy for them to access those services in a friendly way. At the same time, the refugees who are health workers have a livelihood. They've continued to live and continue their profession like any other profession somewhere. I think those are really significant achievements when you look at Turkey. I think there could be more room to grow in all of these areas, providing services to other refugees, because I think the biggest population that receives services are mostly Syrian refugees. There are other migrants. I'm not very sure how much of those have special access to a lot of services and care like the Syrians do. But I think Turkey overall has been a very generous country and has really taken to a great length in terms of honoring the commitments to health for all, especially for refugees and migrants. Yeah.
Thank you so much. So, Dr. Ceren, we have, millions of, Syrians now living in Turkey, and a lot of them have already integrated into the life. And, we have neighbors, and we meet people working in the shops, in the restaurants, everywhere. So it's like now that we know that, many people around are Syrians, it's a nice way of integration into the community. As a health, worker, how do you think this integration works? Maybe you can talk about your own experience, or maybe you can talk about your patients. Maybe I have a more positive view living in Istanbul, in a neighborhood which is really very cosmopolitan.
Now, let me tell you that employing Syrian healthcare workers was my project. I proposed that in 2014, and it was accepted by the Ministry of Health at the beginning of 2016, as it was middle of 2015. Thus, I've been working as of the beginning of the project in the integration in health system of the Republic of Turkey from A to Z, including the administrative tasks. And we would like to thank WHO. They were always facilitated our tasks, and they were always supporting us, and they were always together with us. They had great efforts. We are not planning that these migrant health centers will stay as they are now. We shouldn't think in that way, because they should be within the health system of the Republic of Turkey, and they should be more formal. And recently we have been working for all those Syrian physicians to get their equivalency as soon as possible, and we try to facilitate these processes. For instance, Higher Council of Education of Turkey decreased the passing score from 40 to 35, and the Ministry of Health will provide free permissions. Therefore, so all those services can be provided in migrant health centers to the Syrians with the authorization certificate. But the next step will be to receive the equivalencies, and then it will be more formal and integrated in the health system of the country. This will be a very significant step. Then, as you have stated, for other migrants, for other foreigners, so now I'm not sure about the recent figure, but there are polyclinics which were established for foreign nationals, and 1 million migrants can have the access to the basic healthcare services, excluding the Syrians in those polyclinics. And if I'm not wrong, all those polyclinics can be found in each province, and there are physicians working. And of course, they can speak in Farsi, Russian, or in some other languages. We also employ interpreters in case of a need. Syrians can also go to those polyclinics. And in addition to basic health care services, there are additional burden, for example, post-traumatic stress disorder due to the immigration. So we provide some training for the personnel, for Turkish physicians, and also the patients with WHO. Especially health care workers can feel that burnout, and in order to combat the stress, we provide some cohesion into adaptation training. And for all those physicians working in those migrant health centers, mental health, psychosocial support training were given. So we should pay more attention to how to address this stress. because this stress can be felt by all those migrants, because during the transition in their own country, in the transit and in the destination country, it could not be ignored, but it should be taken more seriously. Thus, the Ministry of Health works together with different associations, and the approval was given to 13 different associations. So those associations, they provide mental health support and psychosocial support. And as you all know, when you provide psychosocial support, there should be a very good language between the patient and the physician and the psychologist for giving these services. So in order to increase our capacity, we work really hard, and we have mobile services for the ones living in the rural areas, especially for the chronic diseases. We try to provide training for the physicians, for the patients. We try to increase health literacy. And we have home-based care. Home-based care has been initiated for the elderly, and they cannot go to the ones who cannot go to the hospitals. So we provide all those home-based care with WHO, and for the maternity, for pregnancy, we provide training, we distribute materials in order to increase health literacy. And as I've stated, these services are not only given to the Turkish citizen, and actually all those services are given one step further, and because it's more sensitive for the migrants. And I would like to call and say that the Ministry of Health is migrant friendly, I might say.
That's great to hear that. Thank you. Ibrahim, as Dr. Ceren was talking about post-traumatic stress disorder and in general stress, you know, it's a very important issue in the contemporary lifestyles. You know, everyone is under stress, but
Sure,
of course there are levels of stress. I mean, when you're running away from war, trying to, you know, escape from all the violence and trying to save your families and your life is at stake, and then you're going through a journey to the unknown, and the level of stress should be very high. Of course, you are very young, and we see this you know, hopeful smile on your face, and but still, how do you cope up with it? It's been a very long process. Now you're in the 5th year, right?
Yeah. So yeah, as you said, I mean, for stress there is like levels, and I believe also like each person who decided to run away from the war, to maybe to go to Turkey or Lebanon, or even to come to Europe, they have like, you know, there is like different levels of stress. Just being, you know, taking this long way from Syria to Germany, it's a lot of stress, of course, because, you know, you have to think, and you have, you know, even like you are in the way, you have to think about the right decision, you know. This is a very long story. I mean, it needs like hours to explain, but also like even arriving to Germany, the stress never ends, because now you have to start a new life, which is mean, you know, you have to think. I mean, it's like a child have been born new, so you have to think about your future, and you have your family behind you, which is, it was, I think, my biggest problem, you know, in the first 2 years, just, you know, to maybe to get used to this life without my family. It was for me, it was my first time, you know, going away for a long time, which is, you know, I still never know how long it's gonna be, you know. So I believe it took me like a lot of time, you know, over 2 years, you know, just to get used to live, you know, without my family. It was a big problem actually for me, you know. It was my biggest problem that I faced. Like I never had any problem, you know, like communicating to my new life, or to the city, or my new friends, or whatever. Like it was very easy, but, you know, having, you know, these feelings all the time with you, that you are missing something, it's terrible. So there was a lot of, you know, I would say like a lot of care giving for refugees to help them maybe, you know, going out of this situation. But for me, it was like very clear. I just need time. I never like needed help, you know, from maybe doctors or something like that. But I just needed time, you know, just to go away of this problem. And yeah, I have also like I have met people who couldn't, you know, handle it, so they decided to go back even to Turkey or to Syria. Like I have like one of my friends who actually came with me all the way from Syria to Germany, who couldn't stay, like just who stayed 1 year and then he decided to go back, and then he went back to Syria because he couldn't, you know. This is it's different from people to from person to other person.
Yeah.
So yeah.
Yeah, I can understand that, of
Yeah.
course. So how do you look at the future? What are your expectations? And did the pandemic affect you badly?
Yes. I mean, about the pandemic, yes, of course, as um, I'm a very social person. Like I have a lot of friends who I used to see like almost every day. In just one day and the other, so everybody has to stay home. Nobody could go out. I mean, go outside of course, but meet other people, it was like, it's still, you know, kind of impossible. It's exactly like in Germany. We are facing the second lockdown right now, and I think it's getting worse right now in the last days, because it was like kind of sunny, so people, you know, I mean, as me, like I miss the sun so much, so when it's sunny everybody go out, and you know, spilling the virus would be like, you know, a big chance, of course. Like the numbers, it's too high right now in the last days. And yeah, about my future, actually, I was thinking about something else, but actually like starting, I mean, after we shot the film, I think I entered the film field, actually, to be honest.
great.
So I'm working in a movie theater as well, and we are preparing for the, I mean, we decided to have like to shoot a movie with Karim each 5 years.
Mm-hmm.
So we are preparing for the second movie, which is we are going to start shooting the film soon. And yeah, I used this time, I mean, we are in Germany, we are in the lockdown since I think November 2020. Yeah. So I was writing a book before about my life, about memories, about my experience actually in the last 2 years in Syria, and the first 4 years in Germany. So actually the the writings and my sounds recover that you see or you hear in the film, it's a part of the book that I was writing.
Mm-hmm.
So actually I finished and I translated to 3 languages, which is Arabic, German, and English, and it will I think it will be public also in the same time with the second movie, maybe in 2 years or 3 years, something like that. So yeah, trying, I mean, you know, this is also, I mean, it's a pandemic, everybody have to stay home, there is not so many options for everybody, but yeah, we were like trying, you know, to use this time, you know, to put some plans for our second movie. And also like I was writing and translating the book with some friends. Yeah, and yeah, my future, I don't know like what I should say, but yeah, I think as everybody, you know, you don't know what's gonna happen tomorrow, so I can't like say, you know, I'm gonna do this or this. So yeah.
Wonderful. It's so good to hear that you've been positive, productive, industrious, and
Thank you so much.
especially in the film field and
Yeah.
literature as well. It's wonderful. Dr. Zikusooka, may I ask you to close this panel discussion for us with your future projections or your comments on the current situation? My wish for everyone is peace in the first place, and health, of course. Today, our theme was, you know, a fairer and healthier world. So what are your wishes or your projections for the future, Doctor?
I think it's very exciting to hear what Ibrahim is up to and his future projections, and that's what every one of us would like to see. wherever you are, whether in your home country or you decide to move to another country, that you make a future for yourself. And I hope that the future can be bright for everybody, wherever they are, and that they can be able to access, access to basic rights, one of which that we champion is health, that we can be healthy and have the right to be healthy, meaning that we have access to services, meaning that we're able to find those services, we know where to find them, and that, it's a fair world. And I think many countries are trying to do that. So I hope that the future will be a healthy future for everybody, for people to realize their full potential, because definitely we all have potential, but unless we're healthy and have other basic needs met, then we cannot realize them. And also that definitely nobody should be left behind. Thank you.
Thank you very much. I thank all of you for contributing to this wonderful panel discussion. And of course, we send our best wishes to Ceren, the director of the documentary, who made a big contribution to the general situation of the refugees. Our film selection can be watched on Festival Scope between 5 and 11 April, as well as our panel discussions. We will leave no one behind.